Morning, everybody.
Thank you so much, sir. Good morning, all the distinguished guests, respected colleges, and dear participants. It's with a great pleasure and honor that I welcome you all on the hands-on workshop on livestock fractures and wound management organized by EMRI in collaboration with University of Wisconsin, USA. Today marks the beginning of exciting and enriching journey where we come together to share knowledge, expertise, and experience in the field of veterinary care for livestock. On behalf of EMRI and the University of Wisconsin, I extend a heartfelt welcome to each and every one of you for being a part of this important event. As we gather here, we acknowledge the significance of advancing veterinary science to ensure the well-being of animals, particularly in managing injuries such as a fracture and wounds, which are unfortunately very common in livestock. Through collaborative effort like this, we are not only enhancing our technical skills, but also fostering a global partnership that ultimately benefits our own animals and communities they serve. So first and foremost, I am honored and introduce and welcome Dr. K. Vasavasar, Additional Director of Animal Husbandry. Sir, your presence here today is deeply appreciated and we are truly grateful for your support. Now I would like to request our CEO, Mr. Joshua Prajapati sir, to kindly come forward and extend a warm welcome to our K. Vasavasar. Thank you so much, sir. I also wish to welcome Dr. N.H. Kedahala, sir, the Vice Chancellor of Kamkenu University. We are deeply honored by your presence today, sir. So I would now like to request Dr. Major Ajit Arora, sir, to kindly come forward and we extend a warm welcome to Dr. N.H. Kedahala, sir. Thank you so much, sir. We also extend a warm welcome to our distinguished guest from University of Wisconsin team member Dr. Ryan. Your collaboration with us on this workshop reflects your commitment to advancing veterinary science and education globally. So I would like to invite our head HR, Ashish Domse sir, to kindly come forward and extend a warm welcome to Dr. Ryan. Thank you so much, sir. I also welcome Dr. P.V. Parikh, sir, Professor and Head of the Department of Surgery and Radiology, Anand Veterinary College. I would now like to request our Project Head of 196 to Dr. Mukesh Chavda, sir, to kindly come forward and extend a warm welcome to Dr. P.V. Parikh, sir. Now I also welcome to our CEO, Sir Joshua Prajapati, sir, because this event wouldn't possible without your support, sir. So I request Head Operations, Satish Patel, sir. Please come forward and welcome to our CEO, sir. Thank you, Satish sir. Also welcome National Head VMLC Major Achin Arora sir. So I request our UMLC Head Dr. Hardik Shah sir, please come forward and welcome to our VMLC Major Achin Arora sir. Thank you, Dr. Hardik sir. Now I would like to invite all our guests to join us for the traditional lamp lighting ceremony, followed by veterinary inauguration. We have proceed for the veterinary inauguration also. Thank you so much, all the dignitaries. Kindly take your respective seats. Now I invite Major Achin Arora to take the ceremony forward. Thank you.
Thank you very much, Dr. Nidhi. So, to begin further the journey of the workshop, I would like to invite our CEO, Mr. Yashwant Prajapati sir, to shower his blessings for this workshop and deliver the inaugural address. We eagerly look forward to you, sir, for your address and insightful words to commence this workshop.
Good morning, everyone. So, we are pleased to have you all here, especially our chief guest, Dr. Kiran Vasawa. He is the Additional Director, Animal Husbandry, Government of Gujarat. Our expected chief guest, Dr. Falguni Thakur, the Director, Animal Husbandry Department. She is traveling, and at the last moment, her schedule didn't permit her to be here to grace this occasion. But she has sent a message for all the participants, dignitaries, and the team from UW that this event is going to add a lot of value in animal care in Gujarat. I also thank Dr. Kilawala, the Vice Chancellor of Kamden University, Professor Dr. Parikh from Anand, Dr. Rian from University of Wisconsin, and our own the leader in the veterinary field, Dr. Major Achin Arora, and a few friends from University of Wisconsin and Dr. Harshad Guria, then all the participants across the districts from government setup. I am really very much pleased and privileged to welcome you all on this important veterinary conference on wound care in fractures and wound care in big animals. So EMRI always strives to endeavor into various innovations and nurturing the skills of the professionals in all the domains of our operation. As we know, few of the veterinarians from Gujarat and few from the Union Territories and few from other states. EMRI is a not-for-profit organization, and Dr. APJ Abdul Kalam, who was the President of India for long tenures, post his retirement, we were lucky to have his grace as a Chairman Emeritus to this organization. And we are operating in 17 states and Union Territories at present for various kind of emergency and non-emergency healthcare services to human and animals. So our Dr. GVK Reddy, who is chairing this organization, GVK EMRI, now it has become EMRI Green Health Services. He himself is a big animal lover, and it is his passion, and this project of veterinary service is very close to his heart. And if we talk about the partnership with University of Wisconsin, we look forward to strengthen our relationship and our outcomes strengthening by proper timely update of the protocols, strong collaborations and involvement of all the stakeholders from both the ends. So this journey, this is a landmark event in our progression in improvement of veterinary services across the states of our operation. Gujarat as a state, very forward-looking state, and the way we are growing in Gujarat, we are at present operating more than 600 animal ambulances in Gujarat, spread across the districts. And I was briefing Dr. Rayan about the geography and terrains of Gujarat. So Gujarat is a state having desert, forest, largest coastal area. It has highly urbanized populations across the state, and we have hilly terrains also, and animals, especially the big animals, are part of our routine life so far as the livelihood is concerned. So the aim of government to double the income of the farmers by strengthening animal husbandry, improving the milk production, improving the health of the livestock. We continuously strive to touch the hearts of the people, touch the hearts of the speechless animals by sensing them through our number of this 1962, and we have a 24/7 call center. I request all the participants and the organizers, especially the contribution of my Gujarat veterinary team led by Dr. Mukesh Chawda. Mukesh has worked day and night, untiring efforts. So Mukesh, I appreciate this shape of this conference with your lot of hard work and support from all your team members. So I wish you take them around the campus just to see the other processes also. Apart from veterinary care, we are into human care. We are providing 24/7 emergency response services through 108 number, which is very popular, a well established and a success story in the PPP initiative of none other than our Prime Minister, Mr. Narendra Modi, when he was the Chief Minister of Gujarat. And we are progressing day and night in updation of the technology, training of the people, retraining of the people, updation of the protocols, updation of our inventories inside the ambulances, updation of the medical equipments, even the features of those equipments inside the ambulances. So we have two set of services, emergency and non-emergency. So apart from 108, we are running 104, which is very popular non-emergency health helpline. We are into women safety and police services also. So we are providing 181 Abhayam Women Helpline, which is dedicated team of trained counselors, own fleet of vehicles spread across the state. And in women safety, Gujarat being the most safer state, we sincerely work towards the gender equity and women empowerment. Beyond that, we are operating mobile health unit, more than 270 mobile medical units we are operating with the team of not less than 1,000 people. And still we are exploring various other projects. Now Gujarat Police is coming forward for police patrolling activities through PPP with EMRI. So we look forward to your support to strengthen all the services in phase by phase. So today's conference, I am sure it will bring in lot of value, and we will try to provide you conducive environment for making this conference very productive. And the team from our UW has also come with lot of preparation, and they are also looking forward to lot of inputs, feedbacks, and area of your interest to make the conference more participative, more interesting. With this small piece of my speech, I feel privileged and I welcome you all again, and I look forward to most productive outcomes of this conference. And once again, I thank the dignitaries, and I must mention our Rajput sir, who has come from Ahmedabad Municipal Corporation. Sir, under your leadership, things are changing very rapidly, and we are sure, I shared the experience with Dr. Kiran Vasawa also, that AMC is coming forward to strengthen, to bridge the gaps and to leverage the resources which are always limited, but how we can maximize the usage of our resources in a coordinator manner. So once again, all the best to all of you, and thank you very much.
Thank you very much, sir, for your kind words and inspiring thoughts in this inaugural address. Now I would like to mention my piece of words also with you and share some thoughts. So I am presently at BMLC head as in Hyderabad location, and working to collaborate with the University of Wisconsin team and take ahead the mission and the motto of 1962 operations to a next level. The workshop, this workshop which is organized jointly in collaboration with the University of Wisconsin team, the motto is that we have a special thought process that our veterinarians which are engaged in the 1960 project, they need an upskillment after their graduation. At the outset, we are confirming and strengthening the process of emergency management actually. The Veterinary Medicine Learning Center is playing a crucial role further to upgrade the simulation centers also with the collaboration of other partners and the stakeholders. In this context, the University of Wisconsin team has helped us out, and in the previous years also, we have done various upliftment tasks of our veterinarians and organized the CE program as a continued veterinary education. On the dais and the dignitaries, I would like to tell you that the University of Wisconsin team has developed various innovative, we are also working on the hands-on sessions right now, and previously also we have done the hands-on session in the farm locations as well. So they are every time supportive to us, and they are upgrading our skills. Thank you very much to you. So this workshop is aimed to advancing the knowledge of the fracture stabilizations and the treatment protocols, and the hands-on training on the wound care management and magazine techniques also. More insights into the veterinary orthopedics and imaging facility, and definitely there will be some case studies scenarios which we will discuss, and there will be a good brainstorming sessions further. These now are not further ado, and would like to conclude my just address that I extend my deepest and gratitude to our management, our chairman, Dr. GVK Reddy sir, and our higher management over there at Hyderabad, as well as the CEO sir, for extending their support, and their team also for this making this event very important and fruitful in the terms of veterinary care and education and the welfare of the animals. I encourage each of you further that you should make most of this workshop and engage and participate and interact with the University of Wisconsin team members, and also to the BMLC team, and take back your invaluable skills and elevate your clinical expertise over there. Thank you very much to all the participants, and we should have a fruitful and enriching learning experience. Thank you very much. Next, I would like to request Dr. Kerawala sir, the Vice Chancellor of Kamdevi University, to please enlighten us with his words of wisdom, and you please claps for him, and just
Good morning to one and all. In this 2 days hands-on workshop on livestock fracture management and wound management, dignitaries on the dais, University of Wisconsin, Dr. Rian, Additional Director of Animal Husbandry, Dr. Vasawa, my good friend, Professor of Surgery, Dr. P.S. Parikh, Dr. Achim Mehra, Jaswant Prajapati, from Ahmedabad Municipal Corporation, Rajputji, Dr. Harshad Goria, from University of Wisconsin, Dr. Tom, Dr. Jen, Kete, all my friends coming from all the Gujarat. I can see from even Divdaman, Selvas, all the team from GVK EMRI. Friends, in this 2 days workshop, and when we talk about importance of CVE, continuous veterinary education, as you very well know that knowledge is a continuous process. Every time we have to improve upon our knowledge. Even our government of Gujarat, Director of Husbandry, has scheme SCAR team, Assistant to State for Control of Animal Diseases. And in that scheme, they are going to organize some refresher course every time. But this type of hands-on training, particularly by private sector, and that too for veterinarians, is a really innovative education media training for all of you. If you go through any foreign journal, you will find residency program. Every time we can, you will find residency program for 8 hours, 12 hours, 16 hours. That is paid program is there. And that paid program is there for particular management. Either it is for imaging, either it is for fracture repairment, small animal surgery. But when livestock comes, I can appraise our friends from University of Wisconsin. that our doctors in India, they are based in livestock treatment, and for that they give big round of applause for all the veterinary. You will never find this type of livestock veterinarians anywhere in the world. They have good experience. They are treating almost daily, if I talk about the daily, 50 to 20 animals, minimum, average. Even as this GVK is providing services, at least they are treating 25 to 50 animals, average. And that too normal. If it is an outbreak is there, it goes in thousands. So this livestock fracture management and healing, it's a base. Fracture management in small animal is very easy. And when we compare fracture management in small and large animals, definitely more means you study your inputs. Outcome, definitely you will get not that much outcome as compared to small animals. But when management is proper, your training is proper, innovations are always there, and that is to be given by this team from Wisconsin. But when these type of workshops are organized, and when all veterinarians are very much here, experienced veterinarians are there, so in this type of workshop you must have bilateral exchange of ideas. What you are doing now and what you are expecting from this university, Wisconsin. Friends, when we, means myself and Dr. Parik is there, we still remember in fracture treatment there is 4R treatment, decompression, reduction, reduction, retention, like that. But now these are far behind. Those are far behind. Forget about that things. Now, what new techniques are there in fracture healing? Wound management. So that type of learning and that's to hands-on training are to be there for 2 days. You will see in our Indian scenario, we don't have that much vertical professionalism. We require vertical professionalism in all fields. When veterinarians are coming out after 5.5 years, now there is 5.5 years course, initially 5 years course, we should expect that they should deliver what your society needs from them. That is 0-day competence. The day he or she become graduate, he should be able to deliver the things what is expected from them. But we are we are having knowledge of all, and we don't have expertise of none. Expertise we don't have. We have knowledge, but in foreign countries, they are having very specific expertise, and that type of expertise required in our country too. Of course, now we have started ophthalmology wing, we have started imaging wing, but that particular specialization, just like in Western country, that type of specialization we required. And if this type of specialization we are having delivery, we can also organize that every weekend or every fortnight, university can organize such type of different courses, workshop, paid workshop. So this 1962 started back, as already informed by Mehraji and Chasunji, that we have started 2005 and slowly it has been, 2005 we have started 108. And I still remember that one story Modi sir used to tell. Nowadays cases for death are not coming from Gujarat. Why it is so? Before I reach home, our 108 is reaching there. That's why there is no case of death in Gujarat. So that way, that type of scenario was there. See, I'll just example your CPR. CPR hands-on training. How many cases you have reviewed after CPR training? Everywhere, now and then, youngsters are facing problem heart attack, and we will require CPR. And now anybody can go for CPR and they can save the lives. So this is the importance of that training is required, and that training, if you are going for that type of training, definitely we are going to increase the outcome of the case, success rate of the case. Dr. Parikh is very much here. He is expert in surgery, especially large annular surgery too. He is going to operate so many cases in a year, small as large annular. So he is also going to share his experience, and then you compare experience shared by our Indian doctor, and that too with that doctor's team coming from Wisconsin. So whatever they are telling, they will be telling as per their experience. I am sure that it will be visible here if you put your extra things there, extra effort there, then it's visible. But whatever Parikh will say, it is applicable to all of us. We can definitely go for that type of treatment, what Dr. Parikh is going to say. And what Dr. Rand and his team is going to say, we are going or we are experiencing in next future to come. And when second this type of workshop is organized, what difficulties you are facing in that type of adopting that technique, that we will discuss. Friends, nowadays 1962 in Gujarat, I think there are more than 8 states having 1962, 8 to 9 states, and we are covering 7,000 villages in Gujarat, almost 7,000. So government is trying their best to providing services, and that too by 1962, just like 108. Our dairy is providing extending their services to their shareholders. So in Gujarat, we are giving very good services for large animals. So this type of workshop is very much helpful to all of you. And these 2 days hands-on training, definitely you become more lucrative, more means realizing the things what are delivered by them, theoretical as well as practical, and putting hands-on training, and that you put it in your future cases to have better success rate. I really congratulate GVK EMRI for organizing such type of workshop, and with this very, I think that there are 50 delegates are there. So you will be now ambassador for this GVK EMRI workshop also. And what you want next time in feedback, you can give it to Jaswant Bhai. So that type of workshop we are going to organize in time to come. I wish you all the best. Thank you very much.
Thank you so much, sir, for your enlightening words. Now I request Dr. P.V. Parikh, sir, to address the gathering and share his experience and expertise.
Good morning, everybody. Ladies and gentlemen, esteemed guests, and my fellow professionals. I am honored to stand before you to discuss remarkable innovations in the field of veterinary surgery in India as a particular. At this juncture, I would like to express my sense of gratitude to Dr. N.H. Kelawala, Vice Chancellor, my friend, and a highly visionary person looking for the development of the veterinary surgery as a whole. The most respected and the head of the Gujarat government, Vasava sir. I tell you, Dr. Vasava sir, his knowledge, his his vision for development of veterinary profession in Gujarat state is really remarkable. And at this juncture, I would like to express my deep sense of gratitude to Prajapati sir, who is a Chief Operating Officer of GVK EMRI Green Health Services. It is his vision to have this kind of programs through VMLC team and all the GVK EMRI team to have such kind of program of continuous veterinary education at the headquarters of GVK EMRI Green Health Services, Ahmedabad. I congratulate them to have such kind of activities here in this campus. At this juncture, I have been told to have some of the rather enlightening or something like breakthrough in the field of veterinary surgery. Some points which I am going to talk to you about innovations and revolutionized veterinary surgery in India. The most important thing which come to my mind so far as the innovations in the field of veterinary surgery, small or large, it is one of the topics that is a minimal invasive surgery nowadays is gaining more popularity. So small incision, reduced pain, more comfort, fast healing is coming up nowadays. So such innovations are really useful. Then advancing imaging techniques. Seeing the unseen, what you can see is definitely through your eyes, and imaging is what you cannot see, that is seen is unseen. Through have your, radio imaging techniques like, now in India we have got almost all the radio imaging diagnostic modalities like digital radiography, we have the ultrasonography, we have the CT scans, we have nowadays to come MRI also in some of the institutions. So such modalities of radio imaging will help you in diagnosis of some of the diseases which you cannot otherwise recognize through your naked eye. Now coming to the biomaterials and tissue engineering, I'm just very much excited to tell you about the biomedical research and the radio engineering. During the Australian, there was a fire in Australia, and at that time a lot of wild animals they got injured. And these wild animals they got a very big burn wounds, and these wounds they got healed with the help of the skin of the fish, that is ferocious fish. Skin was used as a biomedical. They covered most of the wounds with these and they healed very fast. So biomedical engineering is nowadays coming up in the scenario and repairing and regeneration of. And biomedical implants are now available. 3D printing is one of the techniques which is coming up in the field where you can have the customized the implants, orthopedics even. The field of orthopedics gets changed with the help of 3D printing technology. 3D printing technology where you can have suppose you have a loss of bone piece and you want to customize this bone piece. With the help of this 3D printing technology, you can customize, you can get these biocompatible parts available in ligament, tendon, bones which can be repaired. So these are the scenario nowadays is coming up in India for development of the veterinary science. Harnessing healing process, wound management is still the very challenging. Extensive wounds particularly. Skin grafting is one, but in large animal has got particularly in equines, it's a challenging. In small animals again, large animals, but this is again a stem cell therapy and protein-rich plasma, use of protein-rich plasma, stem cell therapy, use of own cells for regenerate new growth tissues is becoming a nowadays more challenging, and it is useful for regeneration and offering less invasive options for repair of the large wounds. Nowadays, what I have seen is on scanning through the references, I have come across some of the references, particularly about robotics, use of navigation and robotics, use of computers for precise or the more precision in surgery. Now, robotics is field which is developing very fast. In human surgery, almost the technology is advancing to such an extent that most of the surgeries are being done by where the precision is taken, the more precise incision with a less invasion and faster healing can be achieved through these robotic surgeries. Again, I congratulate GVK EMRI Green Health Services for having the telemedicine and remote sensing communication skill to taking this medicine field into a remote area which you cannot approach otherwise. By sitting in the office, the knowledge of a professor or knowledge of experts can be delivered at a remote place somewhere in you can say in Sikkim. So this has come. This is really true. This which we cannot imagine even, and this has become such a telemedications and telemedicine has become such a revolution in the whole medicine field as such. After COVID, you might have seen that there is a spurt in the development of this telemedicine. During COVID time, most of the vets, even humans, they are afraid of going to the personally, and they used to go to the telemedicines where the doctors, they have got their sites to deliver the services to the vets, to the human patients, and they used to develop. So this is a kind of field which is largely, this is coming up in the market. Point of care diagnosis. This is again a point of care diagnosis. What is point of care diagnosis? I tell you, point of care. Suppose you need to have you have gone to the place, you have collected the blood samples, and you want on the spot result. So such kind of point of care diagnosis is very, very important in diagnosing some of the diseases. Particularly, I am talking about the RT-PCR and some of the SNAP tests now which has come into the market. They have changed again. In India, almost all kind of diseases are being diagnosed at the doorstep of the owners. Now, these changes has to be put in to the GVK EMRI setup so that this can be further, the scope of the veterinary professional services can be further strengthened. Infection control. I tell you, infection control is top priority amongst all, and in particular veterinary orthopedics or even any orthopedic surgery. Infection care, sterilization is very, very important. This is, you cannot negotiate, you cannot compromise at any step, even if it is a large or small animal surgery. Sterilization. So this is very, very important. And proper use of antibiotic. Again, I request all the veterinarians, those who are here, they please consider which antibiotic you require, what is the proper dosing, and how much you should use it. What are its consequences, or what the effect, how this, whether it is secreted in the milk or not. So antimicrobial resistance again plays a very important role. So this is to be kept in your mind, and you should get yourself updated if you are in this knowledge. So these are the areas, and again specialized veterinary services. I tell you, in India it is developing very fast. You will see the expertise services in small animal. You name the subject, ophthalmology. There are specialized small animal ophthalmic surgeons, ophthalmic clinics are opening in the metros. Even they have percolated to second-tier cities also, like Ahmedabad and other places. There are special clinics for small animals coming up in onco field, where these onco surgeries, even people are now going for the chemo, people are going for the radiations for small animals. So such a development is there in the India so far as the field of veterinary surgery is concerned. Again, I tell you, orthopedics is again a challenging subject. Why I am telling orthopedics? Soft tissue surgery, I know anybody can do it. Those who are very good surgeons, if I can do, I have done number of soft tissue surgeries. I can do any kind of soft tissue surgery. But to attempt for an orthopedic surgery, I need to learn. I need to be very, very, very particular about the asepsis. I have to be very, very particular about, because bone infection, once it gets entered, very difficult to cure. Whole throughout your life, the animal will suffer with that bone infection. So such a scenario where you have come, and the professional development in the field of orthopedics, whatever you are doing in the field or in the hospitals, you need to learn them properly. The day Mukesh Bhai has come to me and he told me that we are going to have a orthopedics, just it reminded me, having orthopedics, really it is a challenging and it is required in the field. And to again a large animal orthopedics, large animal weighing more than 400 kg. Orthopedics surgery, I tell you, any implant you use. I have tried interlocking nail in large animal surgery. I have tried bone plating in orthopedic surgery, large animal weighing more than 400. Everything gets failed. Everything gets failed. I have specially designed interlocking nail for large animals for buffalo. That also got failed. And ultimately what tends to our rescue is external skeletal fixation. External skeletal fixation is one of the most developing field in the field of large animal practice surgery, wherein you should learn how this external skeletal fixation can be used. And this will really help you in field conditions wherein minimum implants you will be using, maximum support from the animals, and repair is fast. So such kind of technologies you need in India to develop orthopedics in surgery. So with this word, I'm very thankful to the Jasunde Prajapati sir, VMLC team, and I'm very much glad to meet Ryan. He's from the heart, I tell you, he's a very good large animal practitioner. The way in which he speaks, the way in which he explains, and whole team of, including the paravets, and this whole team, I'm thankful. We learn from them, and our vets will definitely get benefit out of this training program. So my best wishes are with the team, and all the best to the delegates, those who are attending this function, and we will be gaining some knowledge, and this knowledge will be disseminated in the field, and ultimately the welfare of animal, transfer of education from experts is definitely going to make a change. With this word, I thank you once again.
My sincere thanks to you, sir. And really, you have given a spark to this workshop. I'm delighted, sir. Thank you very much. Now, I would like to invite Dr. K. Vasawa, sir, our esteemed guest over here, to deliver the key address and to enlighten you all. Please.
Good morning. Respected Kelawala sir, Dr. Parikh sir, Dr. Ryan, Jasmine, and Dr. Major Achi. Sorry, we met once. First of all, I heartily congratulate the organizers, EMRI GHS, for the organizing such workshop, especially for the livestock fractures and wound management. Some of the veterinarians from our government dispensaries have also have come here, and lot of has been spoken about the livestock fracture and wound management. You know the basically theories and practicals, and we have two veterinary surgeons who has taught us, especially me, veterinary surgery while during my graduation, Tilawala sir and Parikh sir. So I need not to add much more anything beyond their experience, their words. But as an administrator, as a representative of the Act of Animal Husbandry, Dr. Madam, as just to be told that she could not have come or attended this workshop because of some urgency, and she could not actually reach in Gujarat in time. But she has always, she has conveyed the best wishes to the organizer and best wishes to the participants for this workshop. And let us hope that you get a better knowledge. You can share your experience with the expert, Dr. Ryan, and his team from University of Wisconsin. We know that as a field veterans, basically the wound and fractures are very common, especially even some of the veterans who are working in 1962, particularly in cover animal ambulances. The more than 70% cases are of fracture and wounds. And even in veterans working in the field or dispensaries, they also know that most of the cases are of wounds and fracture. And I can recall, or rather I can say we can recall our days in clinics where we were graduating. The most interesting part of what commonly we used to see in our college dispensary was the wound. And the first word of surgery starts from the word wound, and the second word is fracture. So once again, it's a very important part. You can always share your experience. You can get an expert advice from Dr. Ryan and his team. And this is most important for us because the veterinarians working in the field, you know this, we have to provide services to the livestock owners, farmers, and more importantly in urban areas, is stray animals, where everyone calls for the rescue or the treatment of animals, but you will not find anyone when you go for treatment. But that's our duty, that's our moral duty, so that we have to do. So, and this service is by 1962, you know, that common animal ambulance services or mobile veterinary services. It has added one dimension to our services. In good old days, the veterinarian used to provide services from his dispensary, his or her dispensary, where the livestock owner brings animals to the dispensary. Those days are now gone by. You know, the owners are calling you at their homestead or their village places. So this has actually the introduction of 1962. Mobile veterinary services has added a dimension to our veterinary services in general. So where we provide veterinary services to the villages, to the villages of livestock owners, either through route or on-call services. So in those cases, these are the very important aspects where you can learn from this workshop. And once again, I all the best to the organization and to all the participants for good and healthy discussion, and hope you can get a better and better experience from this workshop, and we hope that we continue organizing such workshop. So once again, I congratulate Jaswant Bhai and his team, Dr. Ryan and his team for organizing such workshop, and Kilawala sir and Parikh sir for being here as our guardian and patrons. Thank you very much.
Thank you very much, sir, for your kind words and enlightenment. Now, I would like further our main collaborative and the representative from University of Wisconsin team, Dr. Ryan, as a leading faculty over here, to express and address the delegates over here.
Thank you and good morning. I stand here today thanking you for inviting us today. I'm very honored as I represent not only the organization but many colleagues beyond my true very friends and colleagues here in the front. We hope that you are going to enjoy what we have prepared for you here today. I have to thank a few people, but in doing so, I want to make sure everyone is thanked. So I'm going to thank in 4 groups. First, thanking all the dignitaries that have brought us here and made this here today possible. Again, thanking everyone at EMRI to help us, because this has been a great deal of work, and without them, we wouldn't have been able to be here today. So we really appreciate all of your hard work from the Indian side as well. My colleagues here, as well as those that are not here, but still have created a lot of good material for you to learn from today, as they will be either teaching you from a remote type of setting or recorded setting, or have provided materials that we will also present to you here today as well. And then the last group of people I'd like to thank is all of you here today. Because yesterday, when we were setting up, I noticed that in the simulation center here at EMRI, there is a poster or a plaque in the simulation center that has the veterinary oath. And I read that veterinary oath, and it's very similar to the veterinary oath we take in the United States. And to sum it up, we, people here, care for animals, their welfare, and their health. And I thank you for wanting to improve that care that you want to provide. And hopefully we not only provide you with information and education, but we gain knowledge from you and our interactions with one another, so that we can develop a stronger veterinary community globally. So thank you once again. We're very excited to be here today and tomorrow to share amongst one another this information in the workshop. So thank you once again.
Thank you very much, Dr. Ryan. And now I would like our CEO, Mr. Jashwant Prajapati sir, to felicitate our guests with the mementos and give a recognition from our organization. First of all, to Wasawa sir, Dr. Wasawa sir, please, if you could promote sir. Now I request Dr. Kirawal sir to please come forward. Now I would like to request Dr. Parekh sir, please, if you can come forward. Now I would request Dr. Ryan.
This request to do the major Rachana. I request Major Ajin sir to felicitate all of you. Thank you so much to all the dignitaries who are sitting all the dais and off the dais also. Now I request to all the participants to proceed towards the DRC for our continuation of a workshop. Thank you so much.